Good afternoon, good morning, wherever you are. Thank you for joining us. I'm Dr. Randall Maxey. We're going to have a little fun today, and we have a different format because there's so many questions out here. But we're excited to have Dr. Barbara Nabors-Stevens, who's been our co-moderator for a good while, Dr. Ivan Walks, who's been a co-moderator, and backed by popular demand is both Dr. Salafu and Dr. Jordan Despani. And we're going to discuss vaccines, everything about them you need to know for your safety. Simon, can you show that first slide? And I would also note that this is medical advice, but it's not without needing to refer to your primary care doctor for real advice. We're giving you education, but nothing we say should be construed as direct personal medical advice to you. And we ask you to pay attention and don't put selling potato chips in the chat room. We want you to have your mic open. You can put questions in the chat. We'll call on you to ask your panelists questions. Let's go with the first slide, Simon. Well, we're in a new situation. I call it our community's new situation. We have the Delta variant and Delta variant plus, and I'm told that we now also have the one called Lambda. We know that 99% of the population that is getting sick and hospitalized are those who have not been vaccinated. We know that mask wearing may be common sense. We're going to talk about that as our first topic. We know that vaccination lowers your chance of variant severity and transmission. Next slide. So we're very, very concerned. Recently, in the New England Journal, they said that only a modest difference in vaccine effectiveness was noted with the Delta variant as compared with the Alpha variant on the receipt of 2 vaccine doses. But there was an absolute difference if you weren't vaccinated. So you need the 2 vaccinations. Next slide. There are things you need to know about Delta. It's more contagious than the other virus strains. It's in more than 80% of US cases. There's 99% of the deaths that are occurring in certain areas. And a person infected with Alpha, which is the one from the UK, will infect maybe 2.5 others. Delta might infect anywhere from 3.5 to 4 times as many people. So this can grow geometrically, and it's outpacing the rate of spread of any other variant. Next slide. So we also know that unvaccinated people are more at risk. I've had a number of calls this week from educated, intelligent, professional people who have not been vaccinated, who have recently turned positive and wondering what to do. But even more importantly, we know that children don't qualify to be vaccinated. So if you have young children under 12, they're at severe risk. We know that adults under 50 are at high risk, maybe 2.5 times more likely to become infected. No vaccine has yet been approved for kids under 12. We know that Delta could lead to a hyperlocal outbreak. It occurs in highly vaccinated areas that are next to a low or poorly vaccinated area. This allows this variant or these variants to grow. One more slide. So I'm going to ask Dr. Salafu to share his screen and speak to us about masks. And I'm going to ask Dr. Nabors-Stevens and Dr. Ivan Walks and Dr. Jordan and myself to serve as questionnaires initially till we have questions in the chat box. Thank you very much, Dr. Salafu.
Okay, may I have sharing privileges, please? Okay, I think I got it. First of all, thank you very much, Dr. Maxey, Dr. Nabel Stevens, and Dr. Walks. It's been incredible last year and this year with the COVID-19 virus pandemic. We've seen a lot of improvements, but we have these waves. They come and then they just cause more trouble. So I'm so happy that we are continuing to provide these kinds of information to our audience so that they can better protect themselves. So today I'm going to be talking about one of the things that we must do, which is basically in the lines of what we call primary prevention in public health. We really want to prevent the problems before they become diseases, and then we are struggling now to provide what we call secondary prevention and maybe tertiary prevention, that kind of stuff. But if we understood what primary prevention actually meant, we would save a lot of lives. So today I'm going to be discussing some of the things that we have actually heard already, but just to reinforce the scientific basis for them happening. So the first one is to talk about the modes of transmission. There are basically three modes of transmission. The first one is contact transmission. You have a direct contact through a handshake or touching a surface that has become contaminated. That can then transmit disease. That's called contact. That applies to basically every infectious disease that we know about. If you have direct contact with the infectious agent, you are likely to be infected. Then we have the droplet transmission. These are, coming from the oropharynx, that is your oral area or your nasal area. When you sneeze, large or smaller particles come out and they travel different kinds of distances. And then somebody picks that up, inhales the droplets from somebody else. Now, the reason it's called droplet transmission is because, when they come out, at some point, they actually drop to the surface. So they don't travel permanently. They travel based on the size, and then at some point, they get to the ground. And we're going to be talking about the sizes in a minute. But in general, transmission, when you have droplet transmission, is most likely when someone is within 6 feet. So if you are close enough for the droplet to travel and get to you, then you're going to catch the infection. If you're far enough, then likelihood is that you're not going to get the infection. So this is an example of somebody who is sneezing. You can see different kinds of particles here, and I'm going to describe them in a little bit. Some of them are heavy, they fall right to the ground, and some of them are intermediate. They sort of fall, to the ground or to some surface later on, and the very fine ones could actually travel quite some distances, sometimes even miles. Then we have the airborne transmission. Airborne just simply means that these droplets are so small that they don't have the gravity to actually reach the surfaces. They can remain suspended in the air for long distances, for many, many hours. An example is TB. TB can be airborne for, long, long distances. All right, so this is the size. These are the sizes of the droplets. So you can see that this gentleman is sneezing, and the larger ones will actually drop like one.
We can't see your slides.
You can't see?
Nope.
Oh, I'm so sorry. Let me go back to share again. Oh, that was an error. Can you see now?
Yes. Yeah.
All right, then I have to go back. It's not going to take too much to go back. So sorry for that. So I was on this slide. So the contact transmission is direct contact. For instance, handshake, touching a surface that has been contaminated. Droplet is what I just described. They come in different sizes, and then they go depending on the distance. And transmission is most likely when someone is within 6 feet, and then the airborne transmission, what I was describing before. And it's an example of someone who is sneezing with different kinds of droplets. The very heavy ones come to the surface very quickly, usually within like maybe 1 or 2 feet, and then the more lighter droplets can travel longer distances. And this
Dr. Salafu, before
Yes.
you leave that last slide,
Yes.
can you just clarify that we don't actually see that though? Someone can put all of that out, but it's not visible like it is in this picture, correct?
That is correct. That is correct. That is correct. So all this stuff, somebody sneezing to you, you are not going to see the particles, of course. Yes, that is a very important point. That's correct. That is why these kinds of talks are very important. This is an electron micrograph. That's why we can see it on the picture. But if you didn't see this, the person will just sneeze onto you, the particles will come and you would inhale them, and then you would contract the infection without actually seeing the particles themselves. All right, this is an example illustration of the same thing, but talking about how, you know, the particle can travel depending on the size. So here, the larger droplets can fall within like 1 to 2 feet. That is the larger droplets over here. And then the intermediate or medium-sized droplets may go up to 2 feet, 2 meters. That's about 6 feet. So this is the range of the COVID-19 virus. It's around these medium droplets. And then the very small droplets can actually travel longer distances and then still be able to cause trouble. So it just simply means that, you know, if you are, you know, around 2 meters away from somebody who's sneezing towards you, you are not likely to get the infection. If you are 2 meters or 6 feet less from the sneezing person, you are more likely to contract the infection. This is another very interesting slide that is describing what happens on the surface, right? This droplet has come down. What then happens on the surface in terms of how long the COVID-19 virus stays on the surface? So look at aerosol. So in reality, if you actually sneeze and there's nobody around, the virus doesn't stay in the air for too long. Within like maybe 1 hour, the virus actually dies in the air if it's airborne, right? On the surface like copper, it's very similar to air, but on cardboard, which is basically the sheetrock around your house and all the other surfaces, the wooden surfaces, it actually sticks around for up to 3 hours before actually dying. And on stainless steel that we use in our kitchens and all that stuff, the virus can hang around for another 5 hours. You know, so this is very important information. On plastic, we all have plastic contacts all around the home, shopping and all that stuff. The virus can stick around those plastic materials for up to 7 hours. Okay, so depending on the surface too, the virus can actually live on those surfaces quite a number of hours. So this is the rationale, the basis for the hand sanitizing. You touch something, you know, somebody sneezes around you, or you are, you know, moving from one place to the other, just keep sanitizing your hands. Or if you touch something, you wash your hands as clean as possible, alcohol-based or non-alcohol-based, but just clean your hands. This is the basis for that, because depending on which surface the COVID-19 actually touches, it could stay there for as long as 7 hours on that surface. This is a simulation trying to figure out what happens with the distance around the perimeter around you when somebody actually sneezes, right? So you have the infected person in the middle. This is a room with different people in different arrangements. This infected person happens to be in this arrangement. Look at the number of people one person can infect. So you have 1, 2, 3, about 14 people. So when you have an infected person and there are people around that person within 6 feet, it doesn't even matter how, you know, many people are, but the denser the people around that person, the more infected people you're going to get. Because, you know, that 6 feet perimeter is where the medium-sized droplets would probably end up, and most people around that perimeter would actually contract the droplets as the person sneezes them out. Now, compare that to the bottom arrangement here, the social distancing arrangement. You have nice arrangement 6 feet apart. If this person sneezes, at the most, maybe 2 people will get infected, at the most. And these 2 people are not even within the 6 feet perimeter. So likelihood is that they will not even get infected. And that is the scientific basis for the 6 feet, okay? Okay, there is also evidence. This is from the New York Times from the beginning of the pandemic in, I believe that was in May of 2020. This was a very nice illustration, putting all those things together to figure out whether clinically it actually happens or not. This was done in New York City. You can see that the density, the more people that were living in a household, the more likely that they were going to get infected. So the density of people in a particular location actually correlates very much with the number of people who would eventually get infected. And this is one of the explanations for why, in New York City, in the, initial part of the phase of the pandemic, the Brooklyn and other areas were, hit hard because the population is so dense in these areas.
Dr. Salafood,
Yes,
can
yes.
you make practical applications of this in terms of riding on an airplane, riding on a bus, going to school?
Absolutely. Yes, absolutely. I mean, you remember that during the initial phase of the pandemic, airlines were basically grounded for the same reason. I mean, the schools were all, at least in New York City, all the schools were grounded. We didn't have, the school system was closed until, I believe, September. 4 months straight, there was no, public school system. So it's all about the crowding. The more people that are close together, the more likely that if anyone is infected and sneezes, you're going to get it. And this is a very nice illustration of that. I really like this graph because it was done during the initial phase, and actually counted the number of people in a household and then did a correlation to see whether the number of people in a household actually correlates with the number of infections. And it was just beautiful correlation. So this illustrates the part of the social distancing. That is, the more we are distanced, the more likelihood that we are not going to get infected. All right, this is a very nice illustration of those facts. I'm going to place the video, so just listen carefully.
Now I'm recording. Stay healthy. Great. Stay healthy. Great. Less loud. Stay healthy. Good. Are you recording? Yeah. Stay healthy. Louder. Stay healthy. Louder. Stay healthy. Nothing.
All right. So this video illustrates the role of masks. Everybody's asking, why am I wearing a mask? So let me, if I can play this video again, I'll be able to explain to you why you should wear a mask. This is without the mask.
Now I'm recording. Stay healthy. Great. Stay healthy. Great. Less loud. Stay healthy. Good.
This is now with the mask.
Are you recording? Yeah. Stay healthy. Louder. Stay healthy. Louder. Stay healthy. Nothing.
Okay. So if anyone is looking at this video, you realize that it's the mask is absolutely a protective barrier, irrespective of the kind of mask you wear. Now, if you have the N95, you could argue that it's more protective. If you have less than N95, you can argue that it's slightly less protective. But any face covering will produce these kinds of results. Any face coverings would limit the amount of droplets coming out of your mouth and infecting another or reaching another person. And this is a clear illustration of that. There's a scientific basis, again, for why we should be wearing the mask. Now, some people will say, well, this mask is porous, this mask is not good, face coverings versus the real surgical, hospital mask. What is it? But it doesn't really matter as long as you have face covering, because it will definitely limit the amount of droplets coming out of your respiratory or your oral cavity. So one of the things that we want to do when we have pandemics is to flatten the curve. I'm sure in the media, everybody was hearing the media, and maybe the governors and maybe the public health officials talk about this, flatten the curve, right? So when you have a pandemic and you have no intervention, this is what happens. The infection just, ravages the population until you reach the peak. And then hopefully you reach your herd immunity because everybody's infected, right? Some will die and some will survive. And then, it will begin to come down. But this is destructive to society. You don't really want this curve. This curve will disrupt life and also the social, phenomenon. The airplanes are not moving, schools have stopped, shops are not opened. It will just disrupt the entire social structure, including the death and all the things that we know about. We don't want this one. What we want is intervention. We want to flatten the curve. When there is a pandemic, we want to institute principles of public health, which is basically primary prevention strategies, social distancing, you wear your mask, and then you sanitize. Those are the three basic principles. That would flatten the curve. And then when you get your secondary prevention method, that is you develop drugs and all that stuff to treat the disease, you can even eliminate this curve or flatten it even further. So that is what we want to achieve. We want to achieve an intervention that flattens the curve. Now, for each of the, we had COVID-19 in March, and now, it's a year and 3 months later, and we still have waves. So each time there's a wave, we still have to follow the same basic principle. We still have to flatten the curve. I just want to mention 2 more slides about primary prevention using the vaccines. I'm sure you're going to have another talk on that, but these are just 2 summary slides. Vaccines, the Pfizer, Moderna, and J&J, very good for the original virus. Look at the variants. They are equally effective in taking care of the variants, right? This is very nice and beautiful. So anyone who has a question as to whether the original vaccines actually can, be effective against the variants, we have very good data to be able to show that. This is another slide, but talk about the Delta virus. I know that Dr. Maxey has already mentioned that, but I wanted to show it because it's very impressive. Look at data now on Pfizer, okay? On the Delta, this is Delta virus right here, the variant. It's almost between 78 and 90-something% effective against the Delta variant. So there is no question right now that the vaccines are actually effective against the original virus or the variants, and now the Delta or Alpha variants of the COVID-19 virus. So I would like to summarize that, for those of you who still have questions, I think we have enough scientific basis for the masks, sanitizing our hands and making sure that we are always free and clear, and making sure that social distance is always practiced at all times. The larger droplets tend to stay in upper, airway and GI tract. The smaller particles can actually go deep into your lungs and cause a lot of trouble, and that's the part that we don't want. So again, we have to be cautious and wear the mask to prevent that from happening. I just said it already. And the vaccines are here to make sure that we have very good primary prevention to prevent this disease from getting to another wave again. So I would like to stop here and then thank you again, Dr. Maxey, Dr. Naples-Stevens, Dr. Walks, for wonderful programs that are bringing these issues to light. So thank you.
Thank you so much, Dr. Salafu. Dr. Neighbor, do you want to make any statements or start questions for Dr. Salafu? And let's also include Dr. Despani and Dr. Walks.
I think that, my pediatrics is coming out again. Nothing wrong with that. This is a really hot topic in not just Tennessee. Tennessee has its own special versions of controversies, but parents of children under the age of 12 especially have to be seriously investigating the situation in their local communities and trying to decide what is the best course of action for them and their children. With the demonstration that you had on the video of the distance that the viral particles can travel, I don't see how anyone can come to the conclusion that masks can't be must be a part of what is advocated for in the schools. But
Yes.
what do you think about these barricades? Some of them are plexiglass, some of them are cardboard. I've looked at them and I just don't see how they can be that effective. Do you have a comment on the barricades?
Okay, this is for in the schools and
In the schools, yes, the contraptions that they're putting
yes,
on
yes,
the desks.
yes. Okay, so the plexiglass and all those barriers, they would definitely stop the droplet from moving from point A to point B. There's no question around that. The question is maintenance, right? Because there's still contact. Remember, there are different kinds of transmissions. One is contact transmission, the other one is droplets, and the other one is airborne. So if you sneeze onto the plexiglass, of course, there's a barrier to prevent somebody else from getting infected. But if somebody then comes and touches that plexiglass, that's contact right there, right? So it is problematic in that sense. However, if actually people go with the first principle, sanitize, every couple of hours, you are sanitizing the plexiglass and that kind of stuff, I think you can actually reduce the rate of transmission because it actually is a barrier to spreading the infection based on droplet. But with contact, it's still there. So we have to do both.
Dr. Sullivan, may I ask?
Can I bring up one other question that I heard frequently, which is, why is it that vaccinated people need to wear a mask? There seems to be a lack of clarity around why that is necessary.
Okay, so the vaccines, the average protection rate, efficacy rate is around 90%. Some are a little bit more, some are a little bit less, but average 90% efficacy rate. So which means that for every 100, we're going to get 10 people who actually got the vaccine that didn't achieve enough antibody to be able to be protective. And there is no way to know who that person is until the entire society has herd immunity. There will be a time where the mask will not be necessary when we reach that point. That is when we reach the 80% point where we think that, okay, everybody is now vaccinated, and then the chance that the 10% is going to be around me, that chance is way, way low, right? But we're not there yet. We're now probably around the 50 or mid 50%. So because we don't know who those 10% are, you still have to wear the mask to prevent the possibility that you are vaccinated, you might be one of those 10%, to prevent the possibility that you might be inhaling particles from somebody else and you might get infected until we all get to herd immunity. Now, at that point where we all get to herd immunity, I don't think that that's an issue at all, but we are on our way. We haven't gotten there yet.
Thank you so much. Dr. Maxey?
There's a follow-up question. I was out walking the other day and people were walking past me. I believe that the virus can be not only droplet spray, but aerosolized. Do you have a concern that if I'm following somebody walking and they're breathing and spreading virus, that if I walk through their cloud, that could give me enough viral load to potentially infect me?
Okay, that is a very, very good question. And the answer is no. You have to have enough viral load to be able to colonize your respiratory and then go down and cause infection. The casual walking around somebody, the person probably is infected with coronavirus. The person sneezes, you are quite distant from the person, let's say 6 feet. You pick up a couple of particles. That is not what we're talking about. Those particles, in society, that happens all the time. We're all walking and moving around, and our immune system is designed to take care of those little exposures. Otherwise, we would just all be vulnerable. Then there will be no society, because the society exists because we have natural defenses for little things. It's when they become big things that we are unable to defend ourselves against. So those ordinary walking exposures are not what we're talking about. We're talking about direct contact where somebody is infected and sneezes and you're within 6 feet and then you inhale a nice dose. Now, also remember that even within the 6 feet, right, that's a cautionary number, right? But even within the 6 feet, not everyone develops the virus when they get exposed, right? So because some people have enough natural immunity to be able to deal with the virus. It's just that most people don't have. So when they get in contact within 6 feet, they are actually more likely to develop the infection. So the short answer to your question is, in the casual encounter, people breathing and all that stuff walking, that is just being a human being. I mean, if we remove that, then we are no longer living as human beings. That is just basically being a human being. The exposure is very low. The viral load that is exposed to the person is very, very low. And the chance that it's going to cause an infection is very, very low. However, with less than 6 feet, you are actually inhaling a dense viral load. That is why the 6 feet is so important. And that dense viral load would overwhelm the immune system, and then your body cannot handle it. And then that's when infection then begins.
Well, thank you. Are there any questions specific to Dr. Salafou? I know he's got to leave early.
Not yet in the chat. Dr. Walks, did you have any?
Sound. We can't hear you.
I was trying to be respectful and mute myself, and I forgot to unmute. So thank you. Dr. Salafou, I always want to focus on just clarity to make sure I understand everything. When you're talking about, when Dr. Maxey asked his question about walking behind someone and you were responding to it, I wanted to be clear that you were talking about outside if he's going for a walk, because sometimes you can be inside in an enclosed area. You're walking in some sort of a room where there are other people, and maybe the droplets are in the air. So can you just clarify whether your answer to Dr. Maxey was just all the time if you walking by someone, or whether you're inside or outside?
My response was based on the assumption that he was talking about outside. Inside, we have to really, really be cautious, because we're in enclosed environments. That 6 feet could actually easily be 8 feet. It could actually easily be 10 feet, because there's air circulation going on. But outside is completely different. So my response was for outside. Okay.
And then just to also clarify, there were some of the very excellent comments that you gave us about the number of people that could be exposed or could get infected with the Delta versus the Alpha. And I don't want to get too far into Dr. Despani's expertise. So for me, it very simply means this can get you sicker quicker if with respect to the Delta versus the Alpha. So when we're talking about something that is potentially more contagious, then we need to be, is it fair to say we need to be even more cautious and keep even more of a distance and make sure that we are even more diligent about wearing our masks? Is that a fair way to say it?
That is correct. That is correct.
Okay.
That is on target.
Dr. Salafou, there are two questions in the chat for you. One is it safe to eat on an airplane? And second, to your response to Dr. Maxey's question about walking outside, do your comments pertain to immunosuppressed people as well?
Okay, immunosuppressed people have to wear them in this environment. All immunosuppressed people have to wear the mask, irrespective of distance and all that stuff. And the reason is just simple, right? The immune system is not enough to be able to handle the same amount of viral load a normal immune system can handle. So they just have to wear the mask all the time, irrespective of where they are. I don't think, and that's also the CDC recommendation, by the way. They have to wear the mask in and out, that is outside and inside, to prevent accidental exposure, because the immune system is just not enough to handle any viral load. I'm sure they can handle a little bit, but nobody knows exactly what that number is going to look like. So it's a subjective description. They cannot handle that much viral load. And therefore, when they get exposed, they are more likely to develop illness and faster and more deadly. So they have to wear the mask. And this is consistent with the CDC recommendations as well.
And eating on the airplane?
The eating on the airplane is very tricky. It's very tricky. The international travels are very, very long. like, you know, some of the international travels could be 6 hours, 7 hours, up to 10 hours. They actually feed their passengers. But you couldn't get on an international travel without a COVID test either. So it is both ways. So they get tested. All international travels, you have to get tested for COVID. And only when you are negative within 3 days can you fly. You see, so I think in that environment, I can say there's some level of comfort, some level of, you know, comfort, and they are actually feeding their, you know, their passengers. On the local flights, though, the flights that are, you know, 1 or 2 flights, nobody's feeding anyone anyway. They might give you a drink, and they're not testing consistently for COVID-19 for the local travels. That is, you know, travel between, you know, within the USA. So since they are not testing, it's a potential exposure. So that is the answer.
Well, thank you so much, Dr. Salafou. I just want to make everybody aware that Dr. Salafou is the chief of medicine at a major medical school in New York. He's one of very few Americans of color handling those big departments of medicine. So we appreciate your time, sir. Thank you so much.
You're very welcome. And thank you too for the invitation. I always feel home having these talks, but the mission is really incredible, and you have my support 100% anytime.
Oh, very good.
Thank you.
Dr. Deshpande, who has been given the Heroes Badge for months and months of telling us about viruses. Why are we so worried about these spikes coming up with people being hospitalized and dying? And why is that? What's different going on than the original deadly virus that we had a year ago? What's new?
Basic evolution, which has always been my explanation, which a lot of people don't really seem to understand, and it's troubling. But again, the reality is that so long as there is a reservoir of susceptible and unprotected hosts, the virus will always mutate, because this is an RNA virus. RNA is more labile than DNA. We know this for a fact because this isn't the very first RNA-based virus that we've fought against, right? HIV-1 has actually been causing problems for years, and nobody, you know, really focuses on that except for infectious disease physicians, even though that's a pandemic that's been going on for what, 40 years now. The reality, though, is that what's happening more specifically here is that, again, like, as people are getting vaccinated, there are these unvaccinated individuals that are just allowing the virus to mutate and continue to evolve its armamentarium of responses. And now you see that it's really a two-way dance, because people often have magical thinking with regards to the vaccines, where they think like, oh, I have I'm vaccinated, so now I can do anything and everything, and that's not necessarily true. Rather, compare a vaccine to a seatbelt. A seatbelt was mandated by the US government to ensure that people would not die as much in car accidents, but a lot of car accidents actually derive from behavioral patterns. So you can use that analog here with the SARS coronavirus 2 pandemic, and that it's not only about having the tools at your disposal, whether those end up being convalescent plasma, whether it's antibodies themselves, whether it's the vaccines, or masks, or even many prophylactic antiviral drugs that are actually being developed now. But rather it's also behavior, because the virus can only spread in response to human behaviors. That's what viruses have done for millennia. So people need to be mindful of that. And you had mentioned beforehand about the Lambda variant, and I guess we can discuss that a little more if you have any more questions.
Okay. So are you saying, let me use Dr. Walsh word to clarify, that we, the corporate we, are actually causing these variants to be prevalent because we are not in sufficient numbers getting vaccinated? Is this an unforced error on our part?
That's part of it. It's not the complete answer, but it's part of it because, as I mentioned before, and that's one of the benefits of having these recorded calls, you can kind of see that I took a humble stance in one of our earlier calls because I thought that I had completely miscalculated everything because it seemed that the virus was under control, and then magically it bounced back because again, I know that like these are how viruses and how cancers that become metastatic work. This is just how humans work, all right? There's always, they try to find a way to survive, right? But with regards to the variants, we know now for a fact, we have the data, we have the evidence that illustrated that what happened was we originally had this original virus that we first identified in Wuhan. And then from there, it eventually had a shift around June of 2019 that, again, many people don't even know these things, but there was a D614G point mutation that actually led that new variant, and it was just 1 point mutation, to outcompete the original parent virus. And then that kind of was alarming, but it's okay, maybe that's only a one and done. And then subsequently we saw alpha, beta, delta, gamma. So this is necessarily how it works. And then with regards to the variant specifically, the data explicitly points to the fact that that these variants like alpha and beta that had multiple, in alpha's case, it had 23 different point mutations. That's a lot. It actually evolved in immunocompromised patients who got infected, and they could not clear the virus for months on end. And in that time, like I've said before, those immunocompromised patients basically served as like a easy training ground for the virus to adapt to the human body. In fact, that's how all viruses evolve from being animal viruses to becoming human viruses. They infect initial individuals. The virus typically is has a high mortality rate. Case in point with H5N1, which is a type of bird flu. And then over time, it modulates its mortality so that it can gain the ability of increased transmission. This is not brand new. This is not rocket science. This is pretty standard epidemiological and molecular biology work.
Let's invite our listening participants to either put questions in the chat or even ask a verbal question. If you could help us with that, Dr. Neighbor and Dr. Wong.
While they are thinking of their questions, and putting either raising their hand to let us know they want to ask a question, or
I see
putting
Dr. Jordan has his hand up. If we can allow Dr. Jordan to unmute. Go ahead, Dr. Jordan.
Can you hear me?
Yes, sir.
Yes.
Thank you. And again, I'm glad it was mentioned earlier about HIV. So much of what we are going through now with this virus, we have been dealing with for the past 40 years with HIV, another RNA virus. The main difference is not airborne, so we're not as worried about it being spread through sneezing, etc. But when we started out, we started treating it with AZT. And the first patients, we can argue on whether they got too much, etc. Some responded very well, but the virus mutates. And we have been catching up until about 2010 with patients who were taking drugs that they became resistant to. And we may do the same thing again here. The virus is not going to just stay stagnant and let us get rid of it. It will mutate. We now have a Delta variant. That does not mean that will be the last or the worst variant. We have no idea what's coming in October or November this year, but we may have something even worse. And what makes them worse is the fact that we have a lot of people who won't get a vaccination. And them not getting vaccine allows the virus to mutate. And there's no way around it. I'm not sure what we can do now, other than try to encourage people as much as possible to have a primary care doctor. We've looked at our patients at Oasis and in the urgent care center. We've had one patient in the past 15 years who was referred to us by a primary care doctor. All of the other patients we have had, and I'm talking about over 1,000 patients, came in the system without having a primary care doctor. In Los Angeles, that is bad. There is no reason for someone to be 20, 30, 40, 50 years old, and that's the only doctors they have been to is either the VD clinic or something happened to go to urgent care. This is not rural Mississippi or Arkansas. So people have access to doctors, and we are not taking advantage. When Kedron Mental Health in Los Angeles opened up and started vaccinating, they've had TV stations there about 5 times. They've done a better job than most, if not the best place, in terms of numbers and everything, except who's going there to get vaccinated? It's right in the middle of the Black community. And most of the people getting vaccinated are white folks and Asians from outside the community.
Dr. Jordan, may I ask you a question? What are some of the reasons that patients have told you that they have not been getting the vaccine?
That's how they're raised. We ask them both, why haven't you got the vaccine? They're scared of it. They don't believe it. They think they're trying to kill us. They can kill you many ways. This is not the way to do it. Do you know that one of the 2 people who created this vaccine was a Black woman? Never before have we had, when you look at the catch points, all the review committees, everything in terms of this vaccine, that is a Black person on it. We have never had that before. And now we have that, and we won't take the vaccine. And it's just, I don't want to take it. Why? Because I don't want to. That, to me, makes no sense. But that's where a lot of people are.
Mhm.
And I think that's what we
Well, thank
need
you.
to have a new way of approaching it. Our present way isn't working.
Dr. Walks, you do a lot of listening from the psychiatrist's couch. Have you been asked questions or told reasons why people don't want the vaccine?
Dr. Maxey, I think I'm in Dr. Jordan's camp personally, with just a lot of frustration with folks who will not take the vaccine. But with respect to what I hear when I talk to folks that say, I'm not ready yet, I'm not sure about it, I don't know about it. There was a discussion in the chat about people believing different sorts of conspiracy theories and that kind of thing. And I think we do have a lot of that happens. I'm always a little bit surprised at people's lack of response to the fact that what Dr. Jordan pointed out. There are historical precedents for us to be distrustful of government. And I'm not talking about history like the Tuskegee experiment. I'm talking about history like last week, when somebody went and got different kinds of care because they look a certain way or they come from a certain community, or somebody believes that because they're not dressed a certain way that they should be disregarded. So we have a lot of reasons to be distrustful. The challenge I have is that what Dr. Jordan said, there are people who don't look like us that are basically trying to push us out of the way to get to the vaccine. The same vaccine that we can get to. People are trying to get us out of their way because they want to get to it. Nobody was trying to bully their way into the Tuskegee experiment. Nobody is trying to bully their way into substandard healthcare. Nobody is trying to get any of that, but they're trying to get this vaccine. And so I think for us, a large part of our focus has to be not so much on telling people that they're silly because they believe a conspiracy theory and what have you, but we can help them understand that the vaccine is safe. We can help them understand that 100 and something million people are fully vaccinated. We can help them understand that from every scientific community, the vaccine is being recommended. Go to your doctor, get a good recommendation. Those are the kinds of things that I think are helpful. I can't tell another person that doesn't make any sense when they say, well, I don't know, I just have a gut feeling. Like, what is a gut feeling? Well, I'm just not ready. Give me a reason and I can respond to your reason. But a lot of people don't have a reason for hesitancy. And I think we have to just encourage them and be supportive and let them know what the science is about the safety of the vaccine and how many people have taken the vaccine. From a mental health perspective, I know Dr. Ron Bailey, my go-to psychiatrist, is on, and maybe we can get a comment from Dr. Bailey on the mental health piece of this.
And that would be good. I want to go to Dr. Nabert though first. I know she collected a lot of information from the recent NMA conference, and she had some questions I want her to throw out to you and Dr. Bailey and Dr. Jordan Despani. Dr. Barbara?
Well, thank you. And I'd like to underscore what we are talking about when we say our community is not taking the vaccine. In our statistics from as of yesterday, only 14% of African Americans in the last week were part of the group of people who got either their first or completed their vaccination process out of the whole population of people who have been vaccinated. We're still trailing way behind. And we had several different sessions addressing vaccine hesitancy at National Medical Association last week. And at the different ones, I listened particularly to hear what the reasons that people are providing for not wanting to take it. This first one, I think, is one that we really have an opportunity to do something about, because it is out there in the community that if you had COVID, a lot of us had COVID. If you had COVID, you don't need a vaccination. And so that's one thing I would ask Dr. Despani to speak to, the ability of naturally acquired antibodies, their longevity as compared to antibodies post-vaccination.
Oh, yeah, you caught me in the middle of trying to finish off answering the question. In a prior webinar that I had given, the data that I had told the Blackout Trust had pointed to the fact that, and I used the analogy of it being that if you had developed antibodies from a natural infection, it was kind of like you were getting snapshots of the SARS coronavirus 2 real variant itself from multiple angles, as opposed to the vaccination, where it's kind of like you just had one photograph. But new data actually points to the fact that the vaccine shots and whatnot actually do also induce multiple, a kaleidoscopic picture taking of the virus. And when I'm using the term like the picture taking and whatnot, I'm basically referring to the types of different antibodies that are generated based off of the different epitopes of the virus, because the virus has multiple points that the immune system can recognize and then utilize the plasma cells to generate B cells that could then bind to that specific epitope on the virus. But the data is fairly encouraging that the vaccination may actually be superior to natural infection for two reasons. One, that a lot of the polyclonal antibodies that are generated following vaccinations, they are typically come from the N-terminal domain of the virus, as well as the RBD, the receptor binding domain. Receptor binding domain is very, very critical because that's actually what the part of the virus that has a spike protein, which is critical for binding to the ACE2 receptor on our bodies and to initiate infection.
Dr. Sanders, can you tell us what an epitope is in a minute? You mentioned the word epitope.
Dr. Despani, can you hear us?
Yes, I can.
He was asking, can you explain what an epitope is?
An epitope is basically a part of a microorganism that is recognized by the antibody.
Okay, thank you.
So basically, so I guess to put it in. Sorry, I could have sworn that I'd heard that he had asked for Yukini, so that's why I was confused. But anyway, to put it in layman's terms, like an epitope basically is kind of like the point. Let's just go with a military reference. So whenever a drone operator like sends out like a drone and whatnot, they usually use like a Hellfire missile or something like that, and it is specifically targeted, I don't know, to destroy, I don't know, some car held by like a Taliban member and whatnot. And like that's basically the analogy here if we want to compare it to, you know, like military conflict, which it basically is really, because your body is trying to fight off the virus before the virus, you know, like causes irreparable damage. So yeah, that's what an epitope is. So, you know, people love to make these simplistic generalizations about like what's going on, like, oh, you know, I have the vaccine, so I'm totally protected, or like, oh, you know, I don't want to take the vaccine because I have to worry about like 5G or being microchipped or whatever. And it's just like, no, you guys are creating all of these nonsensical things when the reality is that the human body, ostensibly that they believe that, you know, like God or whomever created, is already beautiful enough. It has worlds unto itself. So people should want to explore that instead of creating fallacies.
All right.
Thank you,
So,
Dr. Sanders.
so Dr. Neighbor-Stevens, you had a couple more comments from the.
Yeah,
meeting?
and I want to on different topics, but I think I'd like to stay on the safety issue because again, there are many comments that are easily dispelled if you understand the science. One common refrain is the vaccines were rushed into use. The long and short-term side effects are not known, that we aren't hearing all of the facts regarding side effects, and no one is reporting, no one is watching, and a total disregard for what CDC and FDA is doing in terms of safety monitoring. Dr. Despani, would you like to address any of those?
Can we go point by point?
Rushed into use.
Rushed into use. I mean, I on the one hand, that's a two-pronged, it's like a double-sided sword problem, because people are like, it was rushed into use. Maybe, like, I mean, you do realize, right, that we have better technology. Like, the problem is that people, they complain, oh, it was rushed into use. Do you know what the process for making like vaccines was before? We grew them in eggs. You had to grow eggs, and then you had to like harvest them, and you had to, you know, infect them with virus, and then you had to harvest. It was a time-consuming procedure. People actually, they have double standards. On the one hand, they're like, oh, well, science is magical, but at the same time, like, it has to take forever, or I don't want to take the vaccine and whatnot. The reality is that messenger RNA technologies, siRNA, which is called small interfering RNA, gene therapies and whatnot, the reason why we can make them much more rapidly is owing to the fact that genetic engineering and synthetic biology are paradigm shifts. So we can do things now that we could not do before. I'm pretty sure if somebody posed that same question to me saying like, oh, how come you can, you know, like look at genes so quickly? Yeah, because we have technologies and we have tools that we did not have in the 1800s or the 1700s, or even the, like, whenever the Egyptian Empire was ruling the world thousands of years ago. So yeah, that's a stupid tautology. Everybody's happy to get an iPhone every year on the dot, but then whenever they're talking about like, oh, we're making advances in being able to come up with new vaccination modalities, or even being able to come up with gene therapies that can cure people of blindness with one shot, people are like, oh, I don't know about it. The reason why they don't know about it is because they don't have any knowledge. They're trying to be experts in things that they don't know about. And in most fields, people tend to get chastised and punished for trying to like know something about, you know, things without having any actual facts behind them. So it's just
Dr. Spanning.
So Dr. Maxey, can I just jump in for a minute?
Sure.
Because a lot of our audience are lay people, and I always try to think like a layperson because my brain works that way. I like to pretend I'm a really smart doctor. At the same time, my brain really works very simply. And so I think the challenge is that people are getting other information. I don't think folks are sitting at home by themselves and deciding that they don't trust the vaccines. I think that folks are really open to a lot of stuff on social media and different kinds of news networks. You know, back there used to be a time when Walter Cronkite gave us news on CBS and that was it. And now we get so much information that sounds real. And it's from people who we think are telling us the truth. And so that's where a lot of this comes from. So it isn't just a matter of, I'm going to tell you the science and you're going to believe me. It's that you're telling me one thing and someone else that I think is telling me the truth is telling me something else. And that's why I think the mental health part of this is so important. It's not only the bench science that matters, it's also where am I getting information? And so I want to put that out there because I don't want people to think that any of us, especially Dr. Despani, because I know him and I know better, he doesn't think that people are just silly. Dr. Despani understands that people are getting information from different places. And sometimes when you don't have your own scientific background, it's hard to understand who's really giving you the best information. I don't know if that's a fair thing to say, but that's the way I think about it.
That's very fair. In light of that, I'm wondering if Simon can go to the slide that talks about the ingredients of the vaccines, and maybe Dr. Despani and others can comment on that. A lot of people have said that there's mercury in it and it's going to poison you and a number of things. And we have some slides that list the ingredients. And I'm wondering if Dr. Despani, if you and our panel could just comment on some of these things, even though these words are kind of big too. Let's start with the Pfizer vaccine. Do you care to comment on that?
Oh, sorry. Yeah, I'm just doing a lot of things. Yeah, so trying to respond to a lot of things in chat box. So yeah, but regarding what most of these things here, what specifically am I? Like,
this is directly from the website.
Right. Yes, I know. I looked
a lot of people have.
Is there any mercury or any recognizable poison in this list of ingredients?
No, I mean, most of these are, I will clarify that, like a lot of these are potassium chloride, monobasic potassium phosphate, sodium chloride, etc. Like these are all like excipients, and they can also be used as like in industry, right? Sodium chloride and whatnot, but sodium chloride is just salt. Like most of these things are like, they're basically like salts that are utilized in order to help potentiate, like biological reactions, right? Sucrose is just table sugar. Whenever you see like the cholesterol or the phosphocholine, those are lipids. Lipids, that's a big scientific term for fats. So the reason why they have these fats and even as well polyethylene glycol, so that's called PEG. PEG is that is a polymer, and that is actually used in pegylation, which is a type of treatment. Pegylated interferon is used to treat certain like diseases. But We're getting back to the fats and things like that. Like the reason why those fats like cholesterol and phosphocholine are there is because that's actually utilized to create the lipid nanoparticle. So what's cool about these vaccines is that they actually consist of the messenger RNA, and messenger RNA actually exists in your body, believe it or not. In fact, nobody would survive if there was no messenger RNA. But the problem is that messenger RNA is very fragile, so it needs to be protected. So what Pfizer and Moderna innovated upon, which, you know, again, these all come from like research and stuff that was done in the 1970s, really, is that they actually use lipid nanoparticles, liposomes. And liposomes are basically just like small little fat particles that encapsulate the messenger RNA. And that actually helps with drug delivery. Drug delivery is a very, you know, basic general thing. That's actually what I got my PhD in. I was actually doing drug delivery to deliver cancer chemotherapeutics to help treat women, Black women, Hispanic women, Ashkenazi Jewish women who are suffering from the off-target toxicities of chemotherapeutics. So again, these are all like, you know, basic, you know, things. You know, messenger RNA, again, messenger RNA, that's not alien. If you didn't have, like, messenger RNA basically is like I've said before, let's say my mother makes awesome shrimp Creole, and she would never let me take the cookbook. The cookbook is like DNA, so I can make a Xerox of it. The Xerox would be equivalent to messenger RNA. Messenger RNA I can then bring back to my house, and then from there I can use that to like recreate that shrimp Creole. And what's going on in the body is that DNA is used as a template to make messenger RNA, and then from the messenger RNA, that's then read by ribosomes that are in your body, and then the ribosomes are what create proteins. Without proteins, you cannot, nothing on earth can exist without proteins.
Okay, there were two questions from this Dr. Despani.
At least, I'm sorry, nothing biological, sorry.
Can this do anything bad to your DNA is one question. Explain that. And can you get the virus from this vaccine, this mRNA vaccine? And the next slide, I think, talks about Moderna. If you can go to that, Simon.
So yeah, the only difference between the Moderna ingredients is just like, because I'd already looked at all of this before, because I had to answer questions for other people who were worried. They only differ in the type of excipients, and obviously, you know, like that's pretty much it. But again, if you notice, you can even see that they both have PEG, for instance, right? And like, you know, one had acetic acid, you know, acetic acid, that's like vinegar or whatever. So to answer the first question, you had said something to the effect of, can it change DNA? No, like that doesn't make sense. Like the RNA is fragile. RNA cannot influence DNA. DNA is a completely different thing. It's related, but they're still different. They're like DNA, deoxyribonucleic acid, and ribonucleic acid are like very close, like brothers or
so in order to get to the DNA, it would have to get into the nucleus, right?
Right. Yeah. And like the whole thing is that the DNA is kind of like the war room that President Biden goes to whenever he needs to determine if there needs to be an airstrike or something. So he's in the war room, and the whole thing is that if there like needs to be like an actual like, oh, we need to do a surge and whatnot, like obviously Biden gives the command, but at the end of the day, I'm blanking on who the SecDef is. SecDef is a short form for Secretary of Defense, but the Secretary of Defense is the one who, is the one who like manages everything and works with the Department of Defense. So again, that's, you have to use these analogs and analogies. But at the end of the day, no, the DNA, like I think the reason why people are getting confused is that I don't know. I mean, to be honest, I do agree with what Dr. Walks was saying, but I still maintain that people need to be, they need to know the sources of the information. Just like, to eat, good food versus bad food, there are tools that you can use to determine media bias and fact check. In fact, the website is called Media Bias Fact Check, and I am dropping it in right now so that you can actually do an assay, or you can like catalog, like, whether news is like politically motivated, is it objective, et cetera, et cetera. But Yeah, I mean, at the end of the day, I think that people are saying that things are changing their DNA and whatnot because they're confusing technologies. Like this messenger RNA technology is not gene therapy. Gene therapy is a thing, but gene therapies, they cost millions of dollars. Why would I have a startup company that actually makes a gene therapy to cure blindness? And why would I not charge $4 million? Because it's a cure. People talk about like how, like, oh, I want to be able to see. There are gene therapies that can do that. For instance, one of my buddies, he worked at Novartis. Novartis made Zolgensma. Zolgensma treats a type of spinal dystrophy, which is a rare childhood disorder that like is crippling for life. And then that shot, it cures that, but it costs a lot of money. Trust me, no company in their right mind, if they didn't care about cost of goods sold, COGS, would just magically be like, oh, I'm gonna, change your DNA and I'm not gonna charge millions of dollars, because it just wouldn't make sense, because it took decades to move that far.
Let me ask you one more question. Can you go to the next slide, Simon? And tell me, this is J&J. Are there any poisonous or bad ingredients in this that can cause, that people are worried about autism being magnetized by these vaccines? Can you just briefly look through that list and see if there's...
I could tell you one thing that everybody here should always pay attention to, like, like see that ethanol there, like people think that, like ethanol is just a good thing that you can just drink and have your whiskey and things like that. But at the end of the day, you have too much ethanol and you'll end up with hepatocellular carcinoma. So
yeah, but here in this case, we're talking about small amounts, right?
Exactly. Yeah, because obviously it's a nanoparticle. It's just used to formulate
things. It's important to have everything in perspective here.
Exactly. Yeah, and that's a problem. People don't have perspective, right? And then the whole thing is that the J&J vaccine, it does like have its own like drawbacks and whatnot. But as I've said before, like I've mentioned, like a lot of these things that the reason why I'm worked up is because I mentioned this stuff, and it's just like, how many times can I run on the hamster wheel before it's just like you just raise your hands up and just like whatever. But anyway, with the J&J vaccine, that's made using a different technology from the messenger RNA technology. So that's made using adenoviral vectors. I've mentioned this before, and adenoviral vectors, they're good, but like they are an older viral vector technology. Like they're better things than adenoviruses. The reason why we typically use adenoviral vectors is because they are good delivery, like they're good gene delivery platforms, and they don't last in the body forever, right? So, like the type of viruses that you use to make lasting changes to your DNA, those are called lentiviruses. They're derived from HIV. And like those are what are being used for gene therapy, because again, they change your DNA, forever. But again, you would charge millions of dollars for that. You would not charge millions of dollars for something that can be life-changing, like, I'm sorry, correction. You would charge millions of dollars for something that can like be life-changing and can cure blindness, because it'll take, the change will be forever. But for like adenoviral vector, like that actually doesn't last that long, right? It's transient infection. That's what adenoviruses do in nature. They're transient. Adenoviruses cause like some colds and things like that, and they've been repurposed.
Dr. Maxey, I'd like to pick up on the emotion that we saw Dr. Desplaney display and ask Dr. Bailey, because I think a lot of us are feeling it, us, not just medical professionals, but family members, in trying to communicate with our loved ones the need to get vaccine. So I'd like to ask Dr. Bailey to speak to what is it that we need to say? How is it that we need to approach our loved ones in trying to get them to see that vaccines are something that they should seriously consider taking?
Well, thanks for the opportunity. I clearly think that it's a timely point. In my own life, I try to do what you just said earlier, share that the information that they're receiving from me is accurate and authentic and empirical and based on data. But also, to the point that Ivan made, I thought very correctly earlier, tell them that they're probably getting a lot of misinformation from a variety of other sources. And I think that it's a timely issue. I think it's going to be a problem for us for a long time because so many Americans in our community and other communities have grown to accept information that doesn't come from authentic sources. I love the Walter Cronkite analogy, Ivan, or from your doctor. And I think that nobody better discuss this than a psychiatrist, because I believe that because of stigma, and the stigma against mental illness and correct information about brain illness, we probably in psychiatry, not the only medical group, but probably more than any other medical group in the last 100 years, have had to fight misinformation when we take care of patients. One data point that I often like to share with my patients and my friends that are going to call like this is that we're the specialty in medicine. Patients are most likely to come in for an appointment. And think about all the things you got to go through to come in. Get the appointment, take the day off work, drive, park, pay for parking, get your insurance, pay your copay, all that kind of stuff. Get an assessment, get a prescription, and never get it filled the first time. That's not about the doctor. That's about stigma and chronic, repetitive, but unfortunately effective misinformation that I think pervades the marketplace of ideas that patients I think are listened to very, very much. If I could squeeze in, I think another point that Ivan made, and he's right every Sunday, he's right today, that the reality is we don't even appreciate often our patients are not getting it. And the story that I think I like to share is the issue about herbals. Early in my career, there's a lot of discussion about St. John's wort. And patients come in telling me all the time, I'm on St. John's wort, yada, yada, yada. And then finally, NIH did a study, and St. John's wort was no better than anything else, but or any other typical antidepressant. And when you tell patients that, they had a different response, or why they were going to still bill St. John's wort, although NIH, which we all tend to give all the credit to, had stayed. We finally did an actual study. There was certainly something about wanting to believe, wanting to accept, wanting to be very quick to challenge formality and the integrity of the informational process. I think patients for a long time and our families and our communities have been at risk. And I think this recent issue, look at voting again, whether it's the foreigners, whomever, but they've been effective at infiltrating all of these myriad of social information posts from, et cetera, and all of them. And patients are getting social information that can't tell what's what. And unfortunately, that's undermined the credibility of when you and I see them. Those, I think, are really the challenges. And my family, like yours, are as much at risk as everybody else. We should remain, I think, diligent.
We had a couple of hands up. I think Dr. Roberta Doucette had a hand up for quite a while.
Yeah. Hi. Yeah. Hi, I'm Dr. Roberta Doucette. So you're talking about misinformation, which is a segue into what I was had my hand up for. My daughter, who is a young millennial, she's an attorney. She doesn't even deal with the misinformation with these young people, and she's had a lot of success. What she deals with is she just lets them know, okay, so if you do get COVID, regardless of all the things that you think you know about it, if you get COVID, are you prepared to be under house arrest? Because I was under house arrest. I didn't get that sick, but the mental consequences of me being under house arrest with COVID has pushed me to get the vaccine. She goes, regardless of all the other things, what about that? And some of them actually, that sometimes can get to some of them, because some of them feel they're not going to get sick. So all this scientific stuff and everything, they're like, they can't see themselves as a potential victim getting sick with COVID. I just wanted to share that. Thank you. And thank you for bringing that up, Dr. Bailey, about this misinformation.
Thank you. I think Dr. Bailey, did you have another comment?
He needs to be unmuted.
Right, one very brief point. So what I've grown to share, maybe a better answer, I think, for your question, is I like to ask patients, what happens after you get, if you get COVID? So I love the last speaker's comment. And my argument is, if you don't believe in formal medicine and go to the hospital and what the doctors are saying, et cetera, if you get it and you can't breathe, are you just gonna stay home and keep reading social media and everything else saying that there's no COVID and it's all a farce and the Democrats made it together in a life? Or are you gonna rush to the hospital and all of a sudden then quickly become a believer in formality and want some IV Solu-Medrol and want to be intubated and the whole 9 yards? And to a lot of persons acknowledge that if they also can't breathe, then that's different. So clearly, the disconnect is remarkable that a person can say that to you and still and not be able to fully appreciate to me. No disrespect, but the illogical aspect of the construct that one won't believe informed medicine beforehand as to trying to be preventative and progressive in our actions, but then runs to the hospital for what's essentially the most formal medicine response when you have acute symptoms. And my argument is always, that's not how medicine works. If we always wait until somebody's not able to breathe, it's a tertiary level of response. We're trained that we should at least treat you at the secondary level and try to get to primary, which is prevention. So I think there are some strategies to take. Unfortunately, even me telling you this, it takes 3 minutes to get it out. And for so many persons, until you have their ear for this much time, it's hard to try to make a logical response. So much they responded to is illogical.
Let me ask you a question. One of your associates, Dr. Walks and Dr. Bailey is on. Is Dr. Lawson on for a comment?
Yes, Dr. Lawson is on. I see him. Dr. Lawson, are you able to unmute and talk with us? There he goes. You're still on mute, sir. There we go. Go ahead.
Yeah, I concur with what Dr. Bailey, and I just want to also emphasize another point, and that is that not only do people count scientific information as part of the information chain, but a lot of people have beliefs that are non-scientific, and they're counted just as important. And spiritual beliefs, or sometimes religious beliefs, that get totally different sources of information. I think I sent a note in already, but a lot of people think that the vaccine is taking the vaccine is consistent with getting the mark of the beast, as described in the Bible. And I found that was widely accepted. There was even a huge radio debate recently that I saw between several ministers about that point. So the issue is, as someone listening to us and they listen to their physicians, they also listen to their ministers, and they also listen to the person that their buddy that they see walking down the street who makes points as well. And somehow we need to reach out to all of those groups if we can, in terms of making an impact. I know Dr. Bailey and I and others have worked with the religious community, but let's not forget there are other communities as well in our communities that have just as much influence.
Well, thank you.
So Dr. First of all, thank you, Dr. Lawson. And Dr. Lawson also participated in the international summit that we did. So I just want to thank him for all that he continues to do. Let me say one thing real quick, Dr. Maxey. A lot of people think that, well, it doesn't make any sense. Why would somebody say this and why would somebody say that? I want to go back to the fact that we live in a different world than we did 20, 30, 40 years ago. There is a tremendous amount of money in saying something that people respond to, in making a comment that people are going to retweet or repost or whatever it is that they do. Folks get paid for that. And so let's not try to dismiss everything by saying it's silly. I don't think anybody here is trying to do that, but I wanted to make the point that there are reasons why people say things. And so when we understand that there is a market for this kind of what we think may be a wild comment, there is a reason that someone could look at the slide we showed earlier that showed that the Pfizer vaccine contains potassium chloride. How long would it take, Dr. Despani, to look up potassium chloride on the internet and see that too much of it will kill you? Of course it will. Almost too much of everything will kill you. And so when people I'm glad Dr. Despani made the comment about some of these ingredients are used in such minute amounts. And so again, it's not simple. It's not simple to just say everything is ridiculous. People are silly. There's no reason for this. I think what we have to do is to continue to listen to stories of people who are struggling with a lot of different kinds of information. I struggle with being patient and listening to folks who are frustrated and who are afraid that the vaccine is going to hurt them. I have to listen to them and listen to their fear. And then I have to try to give them, in a way that they can understand it, good information that reinforces and encourages them to do something that's in their best interest. I am anybody who is frustrated by all the misinformation and frustrated by people asking questions about, are they going to put a chip in me? I'm the champion of being frustrated. but I understand that what I'm trying to do is to help people move in a direction that's good for them. And I hope that that helps somebody, because it's really hard for me when I talk to people I know very well educated people who still have some challenges here.
Dr. Ivan, I think
There was another comment and perspective that I picked up that I really had to say, oh, wow. So there are people who have high blood pressure and diabetes, and it's controlled. So they don't consider themselves unhealthy or at risk or having any comorbidities. So the messaging, again, plays a big role in how people interpret the information. And Lord knows we spend a lot of time talking about if you've got comorbidities, you're at high risk, blah, 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 blah. But people don't think that they have any risk because their so-called comorbidity is well controlled. So this is another example of you need to meet the person that you're talking to where they're at and not make any assumptions or make statements based from your understanding, but make sure you understand where they are and address them where they are at.
I think that is so important to point to you and Dr. Walks just made, that it's our job as professionals to meet the people where they are and to try to be understanding. At the same time, I agree, it's hard to always be patient, but that's our job. We got to do that. There is an issue that I still haven't heard. Are people going to ask some critical questions of why? I've heard people talk about things like being magnetized, about being sterilized. Pfizer is trying to kill us. And I do know as a nephrologist that when men come to me and express that they have erectile dysfunction, can I give them one of the blue pills? And they take that without question. But little do they know that the need of that blue pill tells me that you have severe cardiovascular risk factors if you're having erectile dysfunction. And if you ever read the package insert on what those pills can do, whether it be to your eyes, your brain, your heart, your blood pressure, you wouldn't be taking those at all in many cases. So I'd really like to have some questions in our chat and from our audience, not just our doctors, but people ask real questions and concerns. So then we'll make up some questions.
Well, Dr. Maxey, I see Dr. Sherrod has had her hand up for quite a while.
Oh, please recognize her.
Can we get Dr. Sherrod to unmute?
Good afternoon. Yeah, I'm unmuted. Can you all hear me?
Yes,
ma'am.
Hi, Dr.
I want
Sherrod.
to commend the discussion. I have a high level of frustration concerning this whole pandemic. And my question is, I think that there is like inconsistency in the messaging that that's being put out there. We're sitting here saying that, oh, well, the reason we're getting the variants is because we still have a large population of unvaccinated people. Well, the vaccine has not been approved for children less than 12. So my concern is about the whole logistics of mitigating this pandemic, because we are going to have unvaccinated people. And I think somebody alluded to it in the chat that, we cross borders. There are some nations who haven't gotten any vaccines. So my question is, and it's a point of discussion, are we really going to get this pandemic under control? We're talking about here in the United States, but even in the United States, we're saying, well, if we could get everybody vaccinated, well, you can't get everybody vaccinated because the kids are not okay. So, and then I think the messages that you hear from the press and social media and all that impacts people, but also their personal experiences. I've had several people call me up and say, My daughter had COVID. She got fully vaccinated. Now she has COVID again. You know, things like that. And then you have the CDC coming out with one message in 1 week. And then the next week, the message has changed. You know, you don't have to wear a mask if you've been fully vaccinated. Then the next week, everybody needs to have on a mask. I think this inconsistency in messaging is a major problem and kind of plays into the conspiracy theories that are out there, that we don't really know exactly what we're doing. And, you know, all the things about people trying to, you know, take advantage or control the population. You know, there are theories about population control and all of that out there. And so people are beginning to question, because we get so many inconsistent messages from people who are supposed to know what's going on, like the CDC and the NIH. So, you know, there are concerns about messaging, but I think in our general population, I think the fear tactic of death or either vaccine is not a good approach. I think vaccines are major, and we need to emphasize that you need to get vaccinated. If you can take the vaccine, do take it. But what are the other options? We're not giving people any of the other options. And the other options are, what do you do to try to keep yourself from, get your immune system strong? Keep your immune system strong. Know what the risk factors are. Know that if your hypertension is under control, you're still at risk. Know that obesity is a major risk factor for, if you get the vaccine, that you will go on to severe disease. I think we need to emphasize those things more instead of saying death or vaccine. Vaccine, yes, you need the vaccine, but what else can you do to try to get this virus under control? And so what about those kids? And, you know, I hear on TV, and it hurts me when I hear them saying, well, it's an unvaccinated pandemic. And all of my pediatric population don't have vaccines, and they don't have them because they don't want them. They don't have them because they haven't been okay for them. So we have to be really careful about what we're saying and who we're blaming. You know, there's a lot of blaming on the media. Now it's an unvaccinated pandemic. So you're saying the little kids are one of the reasons.
So, Dr. Surratt, first of all, you're right on point with what you're saying about the inconsistencies. And I want to remind everybody that early on, when we first started the Black Health Trust, Dr. Surratt and I were the ones giving the list of things you needed to do with your nutrition, with masks and things to make your body more resistant to this thing. So she is right on point. One of the things, Dr. Surratt, with the mixed messaging, as Dr. Walks said, people make money off of controversy. So we know that some of the controversy and mismessaging is on purpose, but we also know that this is a novel virus, meaning it's new. And there's much that we don't know yet about the virus, and it's still learning every month. However, we've adopted the theme lately of common sense. Despite all of the things that we know about vaccines and a number of other treatments and approaches, common sense will protect you along with everything else. We know that whether or not you're grossly obese, but if you're obese even a little bit, there are hormones in your adipose tissue that can affect your immune system. We know that if you're not eating correctly, it can affect your immune system. We know that if you're stressed, if you have PTSD, ACE, and those adverse childhood events can affect your immune system. So there's necessarily a mixed message going on. One of the reasons that we wanted to have this style of meeting today is to come to some common points of common sense that we can dispel certain messages or myths that are out there and get on a similar agenda. I was on the phone with one of our colleagues in Jamaica this morning. Less than 6% of the population of that island are vaccinated. And the government, well, let me not say that, but there's suppression of information. as to what's really going on and why they have such a high death rate, especially among young people. And at some other point, we're going to convene a special group from the NMA, especially to see what we can do for Jamaica and these other Black countries. But Dr. Swan, you're very right. So we're trying to get on the same message today of what are the common sense things we can do. The other thing, and I'm reminded, I was so disturbed, I called Pastor Pointer today, and I was reading Matthew 28, and in there is what's called the Great Commission about go ye therefore and teach all nations. What is it that we as regular people and lay people need to do? It shouldn't take a discussion from Dr. Walsh, Dr. Nabert, and myself, and Dr. Lawson, and Dr. Bailey, and Dr. Jordan Despani to tell people what they need to do. We need disciples who believe in community safety, because we can't depend upon the news media or the internet. That's why we want to dispel as many things as we can today. And I thank you for that question and comment, Dr. Stewart. Dr. Nabert, I know you have some ideas.
I definitely would agree with the comment that messaging has not been helpful. The other thing, though, on another area, though, that came up in all of the comments at NMA was the concerns about, and I know that there was conversation in the chat.
Can I stop you 1 second? Can you define what is the NMA?
The NMA is the National Medical Association, an organization that's 126 years old, and it is the oldest and largest organization of Black physicians in this country. And many of us involved in Black Health Trust are also involved in NMA.
And is anybody on our screen a past president of the NMA?
I was about to say, so involved that they even became president. So, and the convention was this past week, and it affords us opportunity to get continuing medical education that is better than you can get anywhere else, especially when where it pertains to our community. Which is why I was focusing in on all of these different top talks. And let me say that Dr. Ron Bailey gave one of the talks. So I want to give a shout out to him about that. But there was a lot of concern about the safety of taking the vaccine in pregnancy, what it can do to the fetus, if in fact it can impact fertility. There is this talk out there that because you're having this immune response, you're going to have antibodies attacking the fetus. The Academy of OBGYN has put out multiple statements addressing the safety of the vaccine and recommending the taking of the vaccine in women who are pregnant or thinking about getting pregnant. Mothers always are worried about what you take in your body, or should be worried about what you take into your body and what impact it may have on the fetus. There were concerns out there regarding that. Even concerns, we had quite the discussion about breastfeeding about a month ago with Dr. Michael Young. There's even the concern about the breastfeeding. And there are statements out by the American Academy of Pediatrics strongly endorsing taking the vaccine, and that the antibodies do pass in the breast milk and help protect the baby that can't.
So you're saying it's okay and good for women who are breastfeeding to take the vaccine? Is that what you said?
Absolutely, absolutely.
Okay. And what
or if they had taken it, even if they had taken the vaccine before delivery and were thinking about breastfeeding, it is absolutely a good idea to breastfeed if you have had the vaccine.
And if you're already pregnant, should you take the vaccine?
Yes, that is a yes.
Okay, good. So there must be some questions that we haven't answered.
Another question, if I may. My question, and I think we should kind of talk about, and maybe Dr. Despani, since he's a virologist, can this overall approach, or where are we going? Are we really going to be able to mitigate this pandemic in the logistical way we are going about it now in that we're always going to have some people that are unvaccinated. And so if you all could just comment on that, you know, because people travel across borders, there are nations who have no vaccines. Could somebody just talk a little bit about
Yeah, let me
where
make
are
the
we
first
going? Are
comment.
we setting ourselves up to take vaccines, boosters the rest of our lives? Or,
Let
you know,
me make,
that came out, that information came out about we're gonna need a booster, then the next thing, well, I think they were premature in saying that, you know.
Dr. Surratt, let me make the first comment. That's a good question, first of all. Number two, we have to fight the battles that we can fight. We're not the CDC. We're not the US government. We're not WHO. So there's certain things that are battles we cannot even fight. The first battle we can fight is the one within our own community with our own families. And we know that there are other political forces at work. So I, for one, want to handle the microcosm that we as people of color live in. How can we protect ourselves and our families first? Right now, we don't have a nuclear sub or an atomic bomb, so we can do things at the national level. We can do things at the personal level in terms of, like you said, get our bodies healthy, get rid of these health disparities, take the vaccine, take the other things nutrition-wise that we can do. But to say what we can do with the CDC, that's above most of our pay grade. Maybe Dr. Bailey can handle that. But for one, I'm interested in my personal family and friends' safety. At some point, once we get our act together, then we can take on the governments of the world. But we can't solve that on this type of phone. We can solve ourselves. Somebody else.
Let me ask this question, Dr. Maxey. Do you think that we're doing everything we can do for our local communities through this forum? Are we giving out all the information that we can give out to mitigate this pandemic? That's the question.
Well, I think if I hear right in your question, we went about this in the best organized way that we could figure out. We created a task force, and we agreed that we would look at the information that was made available by the Medical Association, in particular the National Medical Association's task force on vaccines and the pandemic. And we had a group of people, which included you, that reviewed their information. And then we voted and decided that we would follow those recommendations and adopt them as a way that we would put out information on the Black Health Trust. Of course, in that, we know that as physicians, there are always anecdotal treatments. There's more than one way to skin a cat. But being a constituted body and a nonprofit corporation, we could not adopt every single piece of information that says this person got cured by this person got cured by that. We picked what we could follow in terms of documented, peer-reviewed information. We've made the best effort to do that. Now, we know that in our internal meetings that happen among physicians and licensed physicians with an NPI on Wednesday nights, we meet once a month, there are no rules. We can discuss any and everything, but it's very important that we don't put out what we consider unsubstantiated information. I'd like Dr. Walks to comment on how we went about that procedure and what you think.
Thank you, Dr. Maxey, and thank you, Dr. Sherrod. It is, no matter what you're doing, it's always important to have somebody ask you, hey, you think you're doing a good job? How do you know you're doing a good job? I think those questions matter all the time. And so with the Black Health Trust, my short answer to you to the question of, do we think we're going about this in the best way? The answer is yes. Do I think that it can be better? Absolutely, because everything that humans do can be done better, because none of us are perfect. What we did is exactly what Dr. Maxey talked about, which is to go through a pretty thorough vetting process, the best one we could come up with, all of us, about the vaccine. But beyond that, the Black Health Trust, I have two other comments. The first one is that the Black Health Trust has, even last week, we had someone on talking about nutrition and diet and things like that. We've had several Black Health Trust programs that talk about making each of us as healthy as we can, so that whatever comes to get us, whether it's the coronavirus or diabetes or whatever it is that's coming to get us, we can stand up to it to the best of our ability. And how we get that information out to our loved ones and to our community. So yes, I think we're doing the best job that we know how to do at this point. Yes, I think we're going about it in a way that is scientific and defensible. And yes, I think we go beyond just talking about the vaccines to really talk about building a healthier community. One of the most powerful presentations I think we had on the Black Health Trust, in addition to Dr. Despani, who I just love because he's so smart and knows so much and shares it with us, is when Reverend Pointer talked about the actual on the ground work that they were doing in his community with the faith community and the medical community. Dr. Lawson, who spoke earlier, works with me on a nonprofit that we work on in Washington, D.C. With the faith community and the health community. So yes, I think we get a lot of information out in a variety of ways from a variety of people. I loved when we had Patrice Rushen on singing and talking about music and how music is a therapeutic intervention for health. So yes, we're going to continue to do that. One last little comment. I know I talk a lot. Y'all, please forgive me. But one last little comment about the information changing. The information changes because we learn more. And I think if anybody would support that comment, it's probably Dr. Despani. Because if the information was not going to change, we could just stop doing science. We would just figure, okay, well, we figured it out, let's go home. But we have to continue, because as things change, everybody's done a crossword puzzle. You know how those pieces fit together? The pieces change. They look different from time to time. That's what mutations are. And so we have to continue to be on top of what's happening. We have to continue to go back. And then the most important thing I think I can say is we have to stay credible, because when the science changes, people have to believe us when we come back and tell them that things are a little bit different. They have to believe us when we say, yes, things are going to change, and we will let you know, because we're telling you the truth now, and we'll tell you the truth later when the truth is a little bit different, because it's going to change. So that whole thing about a trusted messenger, that's what the Black Health Trust is all about. The Black Health Trust is all about bringing together people who have a lot of good information in a way that folks can connect with and stay connected with. So you trust us when we come back and we say, guess what? Something is different. This is what we think. I don't know of anything else that the Black Health Trust can do that's more important than being a trusted place to bring information that we feel is the best information we have from a variety of sources. Everybody from Jordan Despani to Patrice Rushen to Reverend Pointer to Brenda Ager, all the people that are involved in this are doing the best we can. And in deference to Reverend Pointer, we are praying our way along.
Well, thank you. That's why you're my doctor. I really appreciate how you explained it. That's very important.
We have a hand up, Dr. Maxey.
Okay, who is that?
Well, it's RADMJIMDOC. Could we unmute them?
Yeah, that's me, Admiral Dr. Johnson.
Hello,
Thank
Dr. Johnson.
Dr. Johnson.
Dr. Johnson, Admiral of the Navy, U.S. Marine, and good friend.
I just want to make an observation, since we were talking about inconsistency, because I listen to some folks who won't get the vaccine, and it seems astonishing that just a few months ago, we were all trying to get lottery tickets to get the vaccine back in March, and now it's July, and they're paying people to get the vaccine. It's like, what happened in just a few months? But at any rate, the FDA is obviously the one who approves vaccines or any kind of drug. And when you talk to people, they'll tell you, this isn't an approved drug. And the answer to that is true. The FDA has not fully approved the vaccine. It's a long process. We all got the vaccine because the FDA authorized an emergency process, but the FDA has not approved the vaccine the way it's approved aspirin or any other drug. And a lot of people say that the government hasn't approved it. And while we are the CDC, the president, everybody else is talking about the safety of it, and I agree with all that, and I agree with what the Black Health Trust has done. The irony is the FDA still has not fully approved the vaccine. Does it make a difference? I was stunned when I found out that the members of the military had an option as to whether or not to take the vaccine. I mean, and the Navy happens to have the highest percentage, but it stunned me that the sailor, Marine, airman had an option not to take the vaccine. So many things in the military are not optional. If you're ordered to do it, you do it. And the reason is because the vaccine has not been fully approved by the FDA. Military regs say under those circumstances, a military member can refuse to take the vaccine. And they are. And, it's like, I was stunned, but that little piece of inconsistency, and I'm not saying the FDA is doing anything wrong. That's not my point. My point is trying to get people to understand that the fact that the FDA hasn't fully approved it isn't a reason not to take it. But there are a lot of people out there for whom they're saying, this isn't an approved drug, because I've talked to them. And when you look at it from the standpoint of the long, arduous FDA process, which is one of the longest in the world to get anything approved, still hasn't happened. Even though everybody else is saying it's safe and whatnot, the FDA has not approved the vaccine. It's still under an emergency use waiver.
Thank
I
you
can't
so much.
fix that. I can't fix that, but I can tell you that that's a significant issue.
So let me just say, Admiral, first of all, thank you for being on and being with us. And I am not a lawyer by any stretch of the imagination. I think a lot of federal policy is probably a mystery to a lot of people. My understanding is that the long approval process is a necessary one because it keeps us as safe as we can be with respect to that policy. I thought I understood, and please somebody correct me if I'm wrong, that the lack of a full federal approval just means they can't sell it. It means that it's been approved for emergency use authorization, but it can't be marketed. And so it's not a question of, is it safe? It's a question of, has it gone through that much longer process to be fully authorized? But there's no asterisk next to the emergency use authorization that says, well, we're still not convinced that it's safe enough for you to take it. There's nothing like that accompanied the emergency use. Am I right with that?
I think you're right about that, but to the average sailor walking around, of the average soldier, that's a distinction without a difference.
Look, as I know that there are no former Marines, but I was a former airman, and as somebody who was in the military, I'm with you. I didn't get a choice about much of anything. So I agree. When they start giving you a choice and you're in the military, you have to question what's going on. And I think that goes back to my comment about the Black Health Trust. We're taking all the information that anybody has, because it isn't just that we sat around and had a meeting on Wednesdays. We looked at what the FDA did, we looked at what the CDC did, we looked at what the National Medical Association did, and then our vaccine committee on the Black Health Trust side vetted all of that and then came to our recommendation from the Black Health Trust. So we haven't rubber stamped anything. And what we're looking at is that right now, 99% of the people who are dying from COVID are unvaccinated. My first degree was in mathematics. I know from bringing tests home that 95% is not 100. I know that 90% is not 100. I know that there are going to be people who get fully vaccinated and still have breakthrough infections. I know all of that. At the same time, to go back to Dr. Sherrod's point, what is the best that we can do? And I think the best that we can do is to take the best advice we have from some of the smartest people on the planet, people like Dr. Despani, people like Dr. Bailey, other people who have come on to the Black Health Trust and bring their expertise, and people who know how to make things work, like Reverend Pointer. And then we say, what's the best we can do for our community? And I think one of the things we can't do is we can't say to people that because there's not a full authorization of the vaccine at this point. And Admiral, I know you didn't say this. I'm just saying that we can't say that we want people to wait for a full authorization. I don't think anybody is saying that, but I think you're correctly pointing out that there are all of these challenges for people. They're all misinformation, good information, lack of information, changes in information. What do people do? Where do they go? I think one of the places they can go is to Dr. Maxey and the leadership that he's put into our community for decades and say, Dr. Maxey, what do you think? And then Dr. Maxey to say, go to your regular doctor and say, doctor, what do you think?
Well, thank you, Doctor. Simon, can you go to the last set of slides that talks about final word? And I want to say a couple of things and before we leave. So this is my comment after looking at the Matthew 28, that those of us on this call and our friends, we need to make believers of our people, believers in common sense and self-protection. The first word was go into all nations. I changed that to go. It's an urgent and ongoing command. It's a serious and needed mission that we have. Go train and teach personal and public health safety for everyone. We need to appeal to common sense and how this can help protect them and their loved ones, and ask them to join the outreach efforts. And we ask you to join the outreach efforts of the Black Health Trust. Go to the next slide. We want you to teach. And it says teach all people. We want you to impart ideas and knowledge to someone. We want you to model the best common sense. We want you to eat right. We want you to wear masks, gloves if need be. Use social distancing. Tell people they need to take the vaccine. It's the best option. It may not stop you from getting COVID, but it will mitigate the severity of the illness and help protect you from dying. We want you to be prepared and get the knowledge that it takes to teach other people and to transmit this. We want you to help others develop a family health and safety plan. We'd like you to join the Health Trust. It's not just that we have lectures every week, but we want to have discussions and try to bring health and protection to our family. And I'm asking everyone to join us in this effort, and we'll try to continue to provide as much information as we can. Like Dr. Walk said, as information changes, you can trust us to be up on the changes that are coming, but things will change as we go forward. Dr. Nabors-Stevens, Dr. Despani, Dr. Walk, any final words as we move?
For me, I think you said it all. And I hope that it is taken to heart, and whatever we can do to help you in your efforts in your community, just let us know. We'll certainly try to help.
Dr. Despani and then Dr. Walks.
Yeah, just I think things have been said so much better than I could manage, but suffice it to say that there's a saying by John Maynard Keynes, or Keynes rather, who's a economist, a very famous one, who says that when the facts change, my opinions change. What do you do sir, whenever the facts change, and that's the reality. As was stated by Dr. Walks, the nature of science is that, hey, we know something at the beginning, like when we go into something, aka hypothesis, and then afterwards we try to test our assumptions with the current body of available knowledge. The only reason I even am called doctor right now is because I made a novel contribution to the body of knowledge that didn't exist beforehand. And that's the nature of how the scientific enterprise works. So again, it's not perfect, but it is self-refining and reinforcing and whatnot. And that's why they call it research, is because if we had the search, as Dr. Walk said, then that would just be it. But it's research because we're constantly pushing ourselves to grow. You always want to be asymptotically better than you were the day before. And that's the same thing, the same impetus really that drives all of scientific endeavors.
Thank you. Dr. Walks?
I just smile whenever I'm on the Black Health Trust. This much power in one place is just wonderful. And I'm going to end with by quoting another famous person from literature. I'm going to quote Tiny Tim. God bless us, everyone.
And with that, I know Ms. Ager is not on, but we do have our constant and consistent pastor and advisor, Pastor Pointer. We'd appreciate you talking a moment and maybe opining on the wisdom that you may have heard today.
Well, as I've said previously, it's a privilege to be involved with the Black Health Trust. I have used Dr. Jordan Despani very recently with minor children and their parents around the question of getting a vaccine. What are your concerns? And we're using those listening sessions to discover what we will need to do and how we need to fashion it so that we can increase uptake of vaccine. Here in New York, where 70.7% of adults are vaccinated, but we have a large youth population. And of course, we have a dwindling aged population as baby boomers are dying in great droves daily. So our young people must be vaccinated in order for the community to be safe, first of all, and for the community to survive into the future. Young people have to be vaccinated, and we have to give them the truth. When we talked earlier today, what we're talking about is basic evangelism. Notice I did not use the word Christian evangelism. Evangelism is the teaching of information from one person to another that can be done in any discipline. And what we need to do in our community is basic evangelism. Just everyone teach everyone you know, and teach them so well that they can go teach someone else. And then we can really begin to move aside all of the misinformation. And what Dr. Walks alluded to was the money making around misinformation. It doesn't come to our pockets, but it certainly damages our community. So we just need to keep working. So having said that, I'll be back here next Sunday. And I trust and pray that the rest of you will be back here next Sunday, and we will continue to work because it's day and we're a long way from night in this pandemic. So let's just keep working. If you will, I'd like to offer prayer and thanksgiving because we are still here. So holy God, our Father and our Maker, we want to thank you for our presenters today. Dr. Barbara Neighbors-Stevens, Dr. Jordan Despani, Dr. Randall Maxey, Dr. Mauro Salafu, and Dr. Ivan Walks. We thank you, O God, for their work among us. And we ask you if you'll accept this plea. God of all goodness and of all grace, who are worthy of a greater love than we can either give or understand, fill our hearts, we beseech thee, with such love toward thee, that nothing may seem too hard for us to do or to suffer. In obedience to thy will, and grant that thus loving thee, we may become daily more like unto thee, and finally obtain the crown of life which thou hast promised to those that love thee. Through Jesus Christ our Lord, we're your children. This is our prayer. Amen.
Thank you
Amen.
so
My
much,
brothers and
Pastor.
sisters,
And-
it's always a privilege. Thank
and
you,
I'd like-
Dr. Maxey.
Thank you. I'd like to thank Simon Cooper, who is our technical producer, and Ms. Shakini Stevens, our virtual assistant, and our staff of advisors, both medical advisors and our regular advisory committee, and of course, my partners, Dr. Barbara David Stevens and Dr. Ivan Walsh. Thanks, everybody. Have a great, great rest of your day.
Bye, everyone.
Aye.
Good afternoon, family. Praise God.